morning, Miss E. How are you doing today? I'm so glad you were able to make our appointment to discuss your newly diagnosed diabetes. Unfortunately, diabetes has become extremely popular. 11.6% of the United States has diabetes today. If you take a look at the map below me, you can see how the prevalence changed from 2004 to 2021. It has grown exponentially and has a large impact on the southern states. In 2020, Louisiana ranked 46 in diabetes, which is 33% higher than the national average. Recent studies have shown that education, income, race, and environment are some of the few factors that negatively impact a patient's chances of preventing their diabetes. So let's start with what is diabetes? The pancreas produces a hormone known as insulin, which helps control your body's glucose, or sugar. There are two types of diabetes, type 1 and type 2. Type 1 is an autoimmune disease that causes the body to not make enough insulin. Unfortunately, the cause is unknown, and this type is unable to be prevented or cured. Typically, type 1 diabetics require insulin injections for the rest of their life. Type 2 occurs when the body no longer responds to the insulin that is made. So the body can no longer keep up with the amount of insulin it needs. This is caused by things such as age and obesity, but for the most part, a person can prevent their chances of type 2 diabetes through a healthy lifestyle. I wanted to take a brief moment to watch this short video to further our understanding on what we've learned.
This animation focuses on how the body normally breaks down and uses food, and explores how the body maintains a healthy level of glucose, the simple sugar used for energy. There are several types of nutrients. We will focus on how the body digests one type, called carbohydrates, as this most directly affects glucose levels. Carbohydrates are made up of long chains of sugars. After you swallow food, it travels into the throat and down the esophagus and into the stomach. Carbohydrates in the food are broken down into smaller chains of sugars and eventually into glucose, the main energy source used by the body. Enzymes are biological molecules or proteins that help complex reactions occur everywhere in life. Enzymes, like alpha-glucosidase, are responsible for the breakdown of carbohydrates into smaller chains of sugars. These sugars travel to the intestines where they are absorbed into the blood. Hormones such as GLP-1 and amylin are released by the intestines and help to slow food leaving the stomach. These hormones also act on the brain, causing it to slow food leaving the stomach and all around, creating a feeling of fullness. In the pancreas, there are groups of cells called islets. Beta cells, which produce insulin, are a type of cell within the islets. Glucose from digested food and the gut hormone GLP-1 both stimulate beta cells to release more insulin into the bloodstream when food is eaten. Most cells in the body, including muscle and fat cells, need insulin to bind to cells before glucose can enter the cell and be used for energy. Glucose entry allows these cells to function and also lowers glucose levels in the bloodstream. Since most cells in the body need glucose for energy, it's important for the body to maintain steady glucose levels in the blood. The liver helps maintain blood glucose levels by storing glucose when insulin is present. When you are fasting or not eating food for long periods of time, less insulin is present and the liver releases stored glucose into the blood. The kidneys help filter toxins from the blood and excrete them into the urine. The kidneys also filter out some glucose, but the body is able to reabsorb that glucose through protein transport channels on the surface lining of the kidney so that the glucose is not lost in the urine.
As we previously discussed, type 1 diabetics The cause is unknown. However, for type 2, risk factors or causes can be broken down into two categories: non modifiable or modifiable. Non modifiable refers to the things we can't change about ourselves. So, family history, age, race, or if you had gestational diabetes in the past, you are also more likely to carry that on in the future. However, modifiable risks include weight, physical activity, blood pressure, and smoking. Diagnosing diabetes typically takes place in two different ways: through your A1C or your fasting blood glucose test. Your A1C shows us the average blood sugar for the last 2 to 3 months. A normal range is below 5.7. Pre-diabetic range is between 5.7 and 6.4, and diabetes is 6.5% and greater. So your A1C was previously over 9, which puts you in that diabetic range. A fasting blood glucose test is when a patient has fasted or not eaten for like 6 to 8 hours before we take the test, and it's a way to check your blood sugar. So a normal is less than 100. You become pre-diabetic if you're in that 101 to 125 range, and diabetes is diagnosed if you have a test of 126 or higher on 2 separate occasions. So if we take a look, we can see that diabetes can have lasting consequences on multiple body systems. First and foremost, diabetic patients can suffer from delayed wound healing. It can also cause diabetic retinopathy and periodontal disease, which is why it is so important for you to go to your dental and eye exams every year. It can cause cardiovascular disease, which increases your risk of stroke. It can also cause diabetic neuropathy, which is a type of nerve damage that can cause pain and numbness in the feet. This can lead to foot damage, which is why it is important to have an annual foot exam and to wear your diabetic shoes at all times. So insulin can be a good treatment for both. However, it is pretty much type 1 diabetics only treatment plan, except for pancreas transplants for severe cases. However, type 2 diabetics have a wide range of medications that we can try for treatment. First off, we start with lifestyle changes such as diet and exercise. Then we can move into oral diabetic medications such as metformin, which is usually the first line of treatment. After that, we can try GLP-1 medications such as Trulicity or semaglutide, which is an injectable medication that helps increase insulin production in the body. Weight loss is a common side effect. SGL2 medications such as Jardiance work by excreting glucose through the kidneys. And of course, our last line is pretty much insulin, which is again an injectable medication. So now let's talk about a couple of ways that you can help manage your diabetes. So of course, we're going to be having appointments to manage this together, but I do need you to put in some work at home. So there are 5 main things I need you to do. First, we need to work on a healthy diet and exercise. We're going to dive deeper into the healthy diet on the next slide. But increasing the water intake, eating your vegetables, trying to cook at home as much as you can. Physical activity, I want you walking 30 minutes a day or at least 150 minutes a week. Of course, I want you to regularly monitor your blood sugar. You can keep a log, bring it to your appointments. I'd love to be able to review those numbers with you so we can kind of see what's happening and how they're looking. Of course, medication compliance, taking your medicines as prescribed. If cost or insurance ever becomes an issue, I need you to tell me. That way we can maybe try a different medication that is covered so we can keep you compliant with your medication regimen. And of course, follow-up appointments are so important. Your follow-up appointments for diabetes every 6 months, your annual once a month so that we can check on those labs, check on your A1C, see how you're progressing, and of course your yearly eye and eye and dental exam, since we do have those lasting consequences or risk for periodontal disease and diabetic retinopathy. So working on a diet plan can be extremely overwhelming. The American Diabetic Association came up with a simple thing known as the diabetic plate method. So basically, you take your plate, you cut it into 3 sections. The first section, the biggest section, is 50% of the plate, which is non-starchy vegetables. These are going to be your broccoli, your green beans, your onions, your peppers, mainly vegetables. The other 2 sections are going to be split between carbs and proteins. So your proteins, we really want some lean proteins, right? So chicken, fish, turkey, and your carbs, we want those good carbs, right? We want beans, berries, brown rice, sweet potatoes, whole wheat bread. And then, of course, we want you to finish it off with a glass of water or some sort of 0-calorie drink. You don't have to worry about counting the calories, and as you get better at this and you want to start counting calories, there are apps that you can get on your phone, such as the Lose It app is a good one to use. That'll help you kind of tell you throughout the day, oh, you've had this many carbs, this much sodium, how about you need more of this? That's a good way to do it on your phone, and it's right there. And of course, since we were talking about exercise, you could also use the MyFitnessPal app, which can help, motivate you to do some of those exercises, find home exercises. That way it's holding you accountable in an easy way. Last but not least, I did want to go over how we check our sugar at home. So I brought a little glucometer kit with me today that you'll be able to take home. But I wanted to work through the steps of how you check your sugar. That way you feel comfortable doing it at home. So you're going to need a couple things. You're going to need your glucometer, your lancet, which is what is used to prick your finger to get the blood, and some testing strips. All of these can be picked up at your local pharmacy or Walmart. So first we start by washing your hands. Then we're going to turn on the glucometer and insert the test strip. You'll be able, once that's all set up, you're going to prick your finger to get the blood sample. We always prick on the tip of the finger. We don't prick below or on the back of the hand or on the front of the hand, always on the sides. Once you have pricked, you can squeeze some blood and insert it on the test strip. As that's reading, you can wash your hand, put a band-aid, wipe away the blood, do whatever you need to do. And then once the sugar score has showed up, you can go ahead and write it down. Make sure you're monitoring. If it's too high or too low, you can always call the office, and we will work through any issues you're having with that. You can always reach out to me again through my chart, or you can give us a call. I know today was we went over a lot of information and it can be a little bit overwhelming. However, I did print out this PowerPoint for you to take home as a reference. If you forget how to check your sugar, if you needed some ideas on what to add to your diet, different things like that. In 2 months, we are going to do a follow-up appointment. We're going to check your A1C. Okay, I want you to bring your logs to that appointment, and we'll go from there. We're going to see if your number improves or if it gets worse, and kind of any changes we need to do to get you to the right spot you need to be in, okay? Well, you have a good day, Miss E.